non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs such as ibuprofen, naproxen, and aspirin are commonly used to relieve pain and inflammation. However, prolonged use of these drugs can cause kidney damage, particularly in people with pre-existing kidney disease or those who take high doses of NSAIDs. ACE inhibitors are a type of medication commonly used to treat high blood pressure and heart failure. While these drugs are effective at reducing blood pressure and protecting the heart, they can also cause kidney damage in some people. Diuretics are used to treat a variety of conditions including high blood pressure, heart failure, and edema. While diuretics can be effective at removing excess fluid from the body, they can also cause dehydration and electrolyte imbalances that can damage the kidneys over time. The American Diabetes Association recommends several therapies to treat kidney disease in people with diabetes. Controlling high blood pressure is critical to slowing the progression of kidney disease. Blood pressure should be controlled through medication, a healthy diet, and regular exercise. Maintaining good control of blood sugar levels is also important in preventing or slowing the progression of kidney disease in people with diabetes. This can be achieved through a combination of medication, a healthy diet, and regular physical activity. Certain medications, such as ACE inhibitors and ARBs, have been shown to be effective in slowing the progression of kidney disease in people with diabetes. Making dietary and lifestyle changes can also help manage kidney disease. This includes reducing salt intake, limiting alcohol consumption, quitting smoking, and getting regular exercise. Regular monitoring of kidney function through blood and urine tests is important to detect and manage kidney disease in its early stages. In severe cases of kidney disease, dialysis or a kidney transplant may be necessary to replace the function of the kidneys. High blood pressure medications. Medications to relieve swelling. Medications to treat anemia. Medications to lower cholesterol levels. Medications to protect your bones. A lower protein diet to minimize waste products in your blood. Ultimately, by the time a patient reaches stage 5 renal failure, doctors will recommend a workup testing regimen for a kidney transplant. While this may sound daunting and stressful, kidney transplantation has been practiced in the United States for 65 years and is a fairly common surgery. For more information on this subject, contact the American Diabetes Association. If you found this video helpful, please hit the subscribe button and the like button for more information on this and other diabetic related content.